Good, you can see some of the swelling and the pulling through here from the ligamentous and the strain, the shearing that happened right here. Blood usually pools like a week or two later. Hers came pretty quickly, which is a good sign. Hey guys, it's Sven here in Towson, Maryland. I'm with my favorite patient, Christy, and Christy and I go way back. This is our first time really treating a pretty significant ankle sprain. So this year I thought Sven was, circle back, Frozen, okay? There's a movie, and there's two of them I think, and I'm watching Frozen 2, and I'm like, oh okay, this is our shtick this year. This is our family's kind of get up. We're all going to be parts of Frozen. I thought Sven was like the big Swedish dude that rides the reindeer, and then my wife pulls out the reindeer costume, and I'm like, oh, I'm the reindeer, huh? Okay. And my kids are like, get down. And so I've just carried kids around all Halloween now. Princess Anna, not kids, Princess Anna and Princess Elsa, which has been fun. So, Christy and I go way back. She actually did some artwork for my first Scarlet, which was really fun, and I have that up in her room. And then, as well as of Cam and my wife, a picture of Cam looking at the bump, which is one of my favorite pictures. We go way back. She's done some artwork with me. She's got a high ankle sprain and lateral ankle sprain, so we treat that here in our office. Doing some soft tissue work, doing some using acupuncture needles to do dry needling around the tissues that she aggravated during the injury itself. It's about a week old. It's already started to bruise, which is a good sign, so it's signs that she's healing. She's also getting some therapy on the tissues afterwards, after she gets the dry needling done. And then I'm doing some soft tissue work and starting to mobilize the joint a little bit. So, can you take me seriously with this thing on, Christy?
I always take you seriously.
As long as you feel better, that's all I care about.
You know I'm always laughing when I leave.
Yes. So we've got, we're a weekend. I think that a lot of times people get ankle sprains and we get this recommendation off the bat, boot, rest, 3 to 4 weeks, sometimes longer, and we'll find we get better results a lot sooner. We got her into tennis shoes within like 3 or 4 days after the initial injury, and just moving and walking comfortably, not aggravating it, but moving to a point where she opens it up and loosens it up. So there's definitely an art to healing of applying movement and treatment in the right way and manner early on. So we take this 3 to 4 week turnaround and we put it down to a week, and we really speed things up. And then ideally on the back end, just doing the right things from a load standpoint so that she's got good recovery down the road. All right, ankle sprains 101, right there, baby. Boom. So we've got everybody in costume today.
Everyone looks good.
Ho do you like the most?
I haven't seen everybody.
You haven't seen everybody?
No.
Okay. Oh, I see what you're doing. And then who so far?
I'd have to see you carrying around the princesses.
Oh, yes, that's definitely a part of my outfit.
Yeah,
for sure.
you're only half complete.
Who so far have you seen that you've thought, oh, that's a good one?
Beetlejuice.
Brady's Beetlejuice is phenomenal.
He's so tall.
He's such a big dude, I know. He's got his newborn in here right now, and I'm like, this kid's gonna be a giant just like Brady. Lymphatic sweep, some soft tissue work on the top, and I'll get into individual tissues. Just try to get her to relax a little bit. It's hard, it hurts, I know, sorry. There you go.
I'm trying.
I know you are, I appreciate you. Yeah, sorry for the discomfort I'm causing you. It's all in good aim.
No pain, no gain.
No pain, no gain, baby. Pain's just weakness leaving the body.
That's right.
That's one of them, for sure. That'd be the truth. Yeah. Good, bring your toes back for me. Nice, and toes down towards me. Good. So the first week, this is the majority of the work that I'm doing. It's kind of just nice, patient lymphatic sweep in, and then I'll get in and I'll individually strip different tissues, the fascia in that area. Christy, how do you feel after I work on it like this? Not during, obviously.
I know that it's definitely healing faster than it would normally.
Go.
I feel like I have a lot more range of motion when I leave.
Good. So same, better, worse. When I work on you, afterwards my goal is always obviously better. Some sessions will be a little bit more intense and she might be a little rocked for a day or two, and that's okay too. So it's not always like, oh, that wasn't that bad, I feel great, you know. And sometimes it's like, okay, we really dry needled, I'm sore,
Yeah.
right? And we're stimulating that response, but we change the treatment. It's not cookie cutter each time. And then rest. It's hard to sit with this one. It pulls my head back. Like, it's a little too tight for me. It's good. So I'm excited to say that our team is growing again, and we've got a new chiropractor joining us in January full-time, so we'll have 5 chiropractors, and then we have a preceptor joining.
That's awesome.
Yeah, and we've integrated our practice, so we've got primary care, regenerative medicine now part of what we do.
Yeah.
And it's really tailored based off of the needs of Dr. Jeff.
Well, that's nice.
Everything that he's needed, we've created in the environment of the office.
I like that.
And then it's just also served our patients. It's worked out really nicely.
That's awesome.
It's fun. It's been really, really fun to add in the clinical steps. Stay conservative, really drive people towards the gym, and or you know, and kind of meet them where they're at too, like what they're looking to accomplish. If it's just a place to rest and recovery, and injury management in that capacity, stress relief, and then that's what you see me for, right?
Yeah.
Stress relief right
Stress
here.
relief.
This
Yep.
is very stress relieving for you.
Very much so.
Now I got you. Pull your toes. Good. Curl in towards me. Good. And toes back. Yeah, partnered actually with my wife's group, Insight Therapy, so she's got a mental health practice. And so we use them for the real mental health treatment, not what I'm talking about. Like, but there is something to be said about body work that's very relaxing.
Very much so.
Yeah, right on. Are you ready to get to work for real?
No.
We're still in the light phase. It's all good. So we're located in Towson, Baltimore, Maryland. I went to school. Father's a chiropractor. That's Dr. Jeff. That's who I was just saying. And I joined his practice about 8 years ago. Got maybe one future chiropractor below me, I think. One of them might be a chiropractor.
Yeah.
Yep. My oldest is kind of getting into it a little bit. We'll see.
Nice.
It's funny. Either way, I've got a kid standing on my back at the end of most nights, telling me they want to massage my back.
Take a deep breath.
Yeah, and relax right there. I gotcha. And then like sumo squat, butt bounce right on the back.
There you go.
There you go. Good. Bring your toes back. Nice.
I think I'm gonna have more movement in my ankle than I did before I sprained it.
Let go, baby. Let go. I'm trying to get that win. Let's go. There you go. Bring your toes back for me. For maybe, I don't know. This video. What's this video for? Why am I doing this? Right? It's interesting the people I've run into in this world. Whether it's this random kid down in Costa Rica that liked our videos and has been a fan, right? That's so cool. I love that.
Yeah.
And then I met a lot of students in chiropractic school along the way that have used them for education purposes and like to get an idea or a concept of what practice looks like or injury management looks like, because you do get it in school, but it's nice to see real world stuff.
Yeah.
So some of the dorsal ligaments I'm working on the back, I'm taking my fingers and I'm pulling through, and I'm creating dorsiflexion and eversion in her foot, and that creates a stretch on those tissues. So I'm going to hook those fingers in there, and then I'm bringing her toes back gently. And this is where the ankle gets sheared in most eversion sprains. But she really, inversion sprains, but she was really toe heavy when she fell and she strained it. So that's why you see this pattern of bruising through the top of the foot. Come back for me. Go back down. And then I'll work on calcaneofibular ligament through here. This is another really hypersensitive area. Now you're going to point down and in. Usually the mechanism of injury really puts a little stretch on that. Hold, compression, reduces swelling, helps with pain management in the tissue. From a fiber orientation, a scar tissue starts to get laid. It helps it orient it in the right direction so it doesn't get bound up, stiff later on. It improves the function of the ankle. And then I'm going to go through the extensor retinaculum. I'm going to work below and above that. Straight down at me. And so as you can see, every time I've kind of intentionally put pressure on some of these injured sites, it's a little uncomfortable in those areas. So I'm not going crazy on them right off the bat, but I'm definitely warming up. I've added pressure as I've gone on in this session. And it's just allowed me to kind of get a little bit more depth. I'm going to work on some of these tendons, these peronei tertius, and some of these muscles that help extend the foot itself. Just gently sweep through some of these areas. Sorry, Christy. There's a lot of swelling here, not a lot of space, super sensitive to pressure, but she's doing a lot better with it. And then I'll go through and I'll hit posterior tib. Hit as in I'll do pin and stretch through the backside. And that'll help take some pressure off this ankle and calf. Good, you can see some of the swelling and the pulling through here from the ligamentous and the strain, the shearing that happened right here. Blood usually pulls like a week or two later. Hers came pretty quickly, which is a good sign. Alright. And then I'll go to some of these points above. We'll palpate for trigger points, do ischemic compression for 60 to 90 seconds. That's all the hand work that I'm going to be doing with her. Okay. And then I'm really encouraged to try to walk slowly and with control, exaggerate the gait. The more you shorten up the step, I feel like it really doesn't aid in recovery in these kind of cases, not all the cases. That's what I recommended in her case, and it does loosen her up after a while. I'm not going to sneak any adjustments in, I swear. Good. So that's a session of soft tissue work on a sprained ankle. That's I'd say a week and a half.
Week and a half. Mm-hmm.
Okay. And then we've got some at-home stretches exercise that we're doing, some PT in here as well. We'll follow up after 2 to 3 weeks. I'm going to do a lot more with her next week. She'll let me most likely. And from the regenerative side of things, how we would manage this, there comes the sun. Peptide therapy, PRP, and the ligamentous strain that she has as an option. She has an MRI scheduled for Monday that we sent her out for. So we'll find out what's happening from a detailed standpoint. I could diagnostic ultrasound and evaluate like today if I wanted to, but she's responding well to care, and we're not in those phases of making a decision there. We're just trying to become a little bit more ambulatory and get her back to work as soon as possible, safely.
Very much so.
Cool. All right.